Hello and welcome to the Animal Eye Guy. Today we're going to talk about what to expect when you are expecting an eye exam for an eye health test. So when you come in for an eye test, the first thing we would recommend before you arrive is to have all the documents that are required with you. And that includes the Kennel Club registration card. We sometimes have people come in with the 5 generation pedigree, which is the bigger card, we're not allowed to put our stamp on. The Kennel Club registration card is that small green A5 card that is provided from the Kennel Club, ideally with the correct name of the current owner. But you can also have documentation of a changeover in ownership, and we're also allowed to stamp that. When you bring the Kennel Club registration card in, we will then confirm that the Kennel Club number is correct, and that and we will check the microchip and match that to the microchip number on the Kennel Club registration card if that is documented on there. And then we will ask you to sign a form, which is the eye testing form, to confirm that all the data, your address, your telephone number, etc., are correct. If you um, fail to bring the Kennel Club registration card in, we can also still perform the examination. We're not allowed to give you the results of the examination at the time, so we would have to wait for you to send the Kennel Club registration card in, or for you to bring the Kennel Club registration card in. And then once I've stamped the Kennel Club registration card, I'm allowed to give you the results of the examination and present you with the owner the owner slip of the form, which is the white form that you're going to get after completion of the examination. The forms will be sent off to the Kennel Club and to the BVA. It can take about 3 weeks, maybe a bit more than that, for the forms to have been processed and to then go on to the Kennel Club website, where all the findings will be recorded. So for gonioscopy, we need to apply some local anesthetic, and then once that's kicked in, we will apply uh, some coupling gel onto the contact lens, and that will be applied onto the surface of the eye, and then we will have a look with a microscope to look at the so-called drainage angle. So this lens helps us look around corners, and it magnifies, so that gives us a better ability to look at the so-called drainage angle, which is one of the markers that we use for looking for so-called closed angle glaucoma. The general eye exam is performed by applying some eye drops that will dilate the pupil. So that'll take about 20 minutes for that to kick in, sometimes about half an hour. The pupils will then be fully dilated. That medication will be active for about 6 to 8 hours. So on a bright and sunny day, you might find that your dog might be a little bit light shy after the examination. That should have all worn off by the end of the day. When we look at the dog, we usually use two types of tools. One of them is a so-called slit lamp, and that slit lamp is there to give us a magnified view of the eye and an optical cross-section through the eye. So that helps look for things like corneal changes, cataract, etc. And then a second tool called an indirect ophthalmoscope, which is sort of a headset and a lens, and then that helps us look at the back of the eye, the so-called fundus. The examination itself doesn't take very long, so in most cases, in a well-behaved dog, it takes about 2 to 3 minutes, and then we complete the forms, we fill in all the forms, and then after about 5 to 10 minutes, the examination is done, and you can go home. If puppies come in for a litter screen, it is important that these puppies are microchipped. We won't be able to perform a microchip on the day of the examination. So it is important that all of them are chipped, and that those chips are actually working. We do need that as a primary means to identify the individual puppy, because the microchip numbers will be notified on the litter screen examination form. Puppies don't need to be registered yet, with the Kennel Club. They also don't need to have their Kennel Club registration cards with them, so we don't tend to stamp those. We only tend to stamp the adult Kennel Club registration cards. So puppies just need to have a microchip and ideally some form of um, proof that what the microchip number is, so we can compare it. So for dogs which are tricky to examine, and that usually is more relevant for the so-called gonioscopy compared to the general eye examination. We try to give them enough time to settle in, but in some cases it is impossible to look at the front and the back of the eye. We won't be able to say whether or not that dog is affected by any potentially hereditary eye condition. So in the worst case scenario, we may have to delay the examination for a separate appointment, and perhaps get some extra training. So luckily, Darren, who from Kirkbourne, is a trained dog trainer, so he might be able to help you with that. In some situations, if it is very difficult, and the dog is untrainable, we may need to consider giving them some mild tranquilizers as a tablet a couple of hours before the examination. That is a last line of treatment though, because we normally don't encourage having to tranquilize patients for a routine eye examination. So most dogs which are suitable for breeding purposes should be able to allow a 2 to 3 minute examination. For dogs requiring tonometries, so those are the breeds with open angle glaucoma, or the breeds that we're screening for open angle glaucoma, they would only come in for a so-called tonometry test, where we use a device and some local anesthetic to numb the surface of the eye and then take an eye pressure. These are very few breeds, and here you can see a list below of what breeds require tonometry. These are the breeds that require gonioscopy, and these are the breeds that require a general eye examination. If your dog is not Kennel Club registered, we can still do the examination. All the data, all the findings that we find are going to be recorded on the form that we're filling in. We will send the documentation off to the BVA as well as to the Kennel Club, and they will screen them for findings. So it is recommended to examine breeds even if they're not on the list of presumed inherited eye diseases. So the more dogs we see, the better for the breeds. If a dog fails the examination, and that can be on the basis of a gonioscopy, or that could be on the basis of a finding during the general eye exam, you have the option of appealing the decision. Every failed patient will get an information sheet, or you will get an information sheet where the appeal procedure is documented how to do that. The way to do it is you would have to contact the BVA, ideally within 30 days after the initial eye examination has been performed, to notify them that your dog has failed the exam. They will then appoint a second panelist to do the examination. So you would have to go to a different panelist to get a second opinion. I'm afraid that would incur additional costs for an extra eye examination. If the two panelists agree with the decision, then that appeal is nullified. If the two panelists disagree, then the chief panelist will then be appointed to make a final examination. That final examination is free of charge, and then the chief panelist decides what the correct finding is. The appeals procedure is a very important procedure to follow. It helps with avoiding breeders from going from one panelist to the next and getting multiple different opinions and causing confusion. So it is a very, very important procedure to follow, and it makes the scheme better. It makes life a lot better for breeders as well as for us panelists. So everybody will benefit from that. If a puppy has failed an exam for a litter screen, you also have the option to appeal that decision. Usually the chief panelist is appointed directly to have a look at that particular puppy, so they doesn't have to look at the entire litter, but just that one particular puppy who's failed the examination, and then that decision is final. The reason for that is that puppies tend to grow very quickly, their eyes tend to change very quickly, so findings that might have been found at 7 weeks could have disappeared by 12 or 13 weeks, which is why time is of the essence. So hopefully you found this information useful. If there are any further questions, please feel free to reach out, um, and or ask your panelist about any further questions. Thank you very much. Bye-bye.